Okay, today we are going to discuss about the topic things to know about FRCR training. Okay, you can start the session.
Yeah. Okay. Good evening, everyone. Today I'll be talking about the FRCR examination. As you all know, FRCR is the Fellowship of the Royal College of Radiologists exam, the UK postgraduate exam. And so Texila American University, in partnership with the Central University of Nicaragua, offers a comprehensive 3-year structured training program to clear the Royal College examinations. And the clinical training is provided by NABH accredited hospitals, and it enables us to practice an advanced career subject to registration with local medical council and fulfilling the other requirements. And it gives us an opportunity to become a member or a fellow of a respective royal college, and it is a supervised training by the Royal College of Certified Faculties. And to book for the FRCR exam, we'll first need to register for an RCR account, and with that, we'll get a unique RCR number. From there, we can book the FRCR exams, and the priority is different for different candidates. Like first, it is for UK resident members and then non-members. And the FRCR exam, it takes place in multiple exam centers in the UK, Singapore, India, Egypt, Malta, and Hong Kong. Currently in India, as you all know, it's only in Hyderabad. Now, for the to be eligible for the FRCR exam, a person has to hold a primary medical qualification that is recognized by the GMC for registration purpose, and the doctor also has to hold a formal clinical radiology post in which they are actively receiving clinical radiology training, and there is no minimal period of clinical experience or training required to enter the exams. Uh, are you able to see my screen fully?
Yes, I can see your screen.
Okay. So the study resources for the FRCR exam, like for anatomy, the ideal books would be Imaging Atlas of Human Anatomy by Abrahams, Pocket Atlas of Sectional Anatomy, and Anatomy for Diagnostic Imaging by Ryan, and Applied Radiological Anatomy by Butler. For physics, the ideal books would be Past Physics for Medical Imaging, Christensen's Physics of Diagnostic Radiology, FRCR Physics Notes, and MRI in Practice by Catherine Westbrook. For the FRCR2A, like the FRCR, the second part, the ideal books would be Cut Through FRCR Part 1, MCQs and Mock Examination, Single Best Answers for FRCR Part 2A, Cambridge Medicine Paperback, Revision Notes for Final FRCR Part A, the second edition, postgraduate exams, and Granger and Allison's Diagnostic Radiology, the 2 volumes. For the FRCR 2B exam, the ideal books would be Final FRCR 2B Viva, a survival guide. This is the Cambridge Medicine and Paperback book, Emergency Radiology, the requisites, Chapman and Ekelny's Aids to Radiological Differential Diagnosis, and Rapid Review of Radiology. Now, for an effective study plan for the FRCR exam would be to revise, and repeat revision. Revision is the key to success. In order to retain most of the complex concepts in radiology, revision must be done at least 3 times. And if the time is short, then more revisions must be done rather than spending more time on more books. Now, I'll speak about the structure of the FRCR exam. The FRCR Part 1 exam consists of anatomy and physics. Physics is for 2 hours and includes 40 MCQs. The topics included for the physics paper are matter and radiation. 4 MCQs will be asked. Radiology and fluoroscopy, from this 8 MCQs will be asked. Radionuclide imaging, 6 MCQs. Radiation safety, 8 MCQs. Computed tomography, 4 MCQs, magnetic resonance imaging, 5 MCQs, and ultrasound, 5 MCQs. And the anatomy exam lasts 90 minutes and includes 100 images. There are no moving images. It is just an arrowhead pointing towards image which we have to identify. And these include cross-sectional, plane radiographs, and contrast studies images. And the topics covered in the anatomy exam are head, neck, and spine, chest and cardiovascular system, abdomen and pelvis, and musculoskeletal system. For the FRCR Part 2A, it includes two 120 questions, single best answer papers, and it covers musculoskeletal and trauma, central nervous system and head and neck, cardiothoracic and vascular, gastrointestinal, genitourinary, adrenal, obstetrics and gynecology, and breast, and pediatric. And the final FRCR exam, Part B, includes a reporting session of long cases and rapid reporting session, also called rapids, oral exam, the viva session, and the reporting session lasts 75 minutes and involves a written report of 6 cases. The rapid reporting content lasts 35 minutes and includes 30 cases. The oral component consists of two 30-minute segments with 2 pairs of examiners, and the examination lasts 60 minutes. And the 3 subtests of the final FRCR Part B is independently marked. So the 3 sets of marks are considered as a whole to generate a pass or fail. There is no concept of passing one part only. Thank you. And so these exams, they are usually held in March, June, and September. Like usually the first part, anatomy and physics, it's held in March and September. And the FRCR Part 2 is held in March, June, and September. And the first FRCR exam costs around 256 euros for members and around 300 euros for non-members. Thank you.
Yeah, thank you.